Hi everyone, my name is Dr. Lin. We are going to talk about thyroid condition and how I'm here to help you to improve your thyroid condition. First of all, I'd like to claim that I do not treat or cure thyroid condition. I merely help your body to increase the function so that the body, when it's at the optimal function, it will cure and thyroid with the body itself. Okay? So what I do is to find the blockages, find whatever it is that prevents thyroid from getting better. Take it out. Take out the blockages. Take out the hindrance that prevents the thyroid to get better. Okay, again, I do not cure or treat thyroid. Okay, so let's continue. A lot of patients, when they come to me, and they have various conditions, and a lot of patients, they come to me, they have thyroid issue. And most of the patients, when they come, or before even coming to me, they have already gone through their primary physician. They have already seen their primary physician, and the physician have already given them blood testing, have given them Thyroid, have given them all kinds of medication, and no help. Even though they did the blood test, and the blood test shows all normal, but they still have thyroid condition. They still have the symptoms. They've been to endocrinologists, have the shots, have vitamin shots, have more medication, still doesn't work. Still the same. Symptoms still gets worse and worse and worse. They went to even thyroid specialists, more medication, it doesn't work. Okay, they try hormone replacement. They even try other kind of thyroid supplement. Nothing works. They still have horrible conditions. And the strange thing is, the blood test shows all normal, but their symptoms keep on getting worse. Is that you? Does that describe you? And when you go back to your medical doctor, you tell your doctor, I took all this medication, my blood test is normal, why am I still feeling so bad, so horrible? Why? And your medical doctor, your specialist, your endocrinologist will probably say in front of your face that it's all in your head. Learn to live with it. Okay, you're crazy. Everything's normal, you're just crazy. Okay, I'm going to send you to psychiatrists, psychologists. I'm going to send you for counseling. Must be all in the head. It's not you. I've done everything correct. It is you. It is not my problem. Okay, that is most of the medical doctor answers. Okay. So why are you feeling so horrible? There has to be a reason why. So that's why I'm here, to help you find out what is the cause of all these thyroid issues. What is the underlying cause? What do we do? How do we dig it out? What test do we find out? How do I help you to improve? This is what the video is about. So please continue, listen to the videos. Okay? And some patient even asked, there's some patient might even say that there's something growing in my thyroid. Should I just cut it? Will cutting the thyroid improve my condition? No. Even if you have surgery done, your thyroid condition is still there. Okay, and I will explain to you why. Continue listening. Okay, I'll explain to you more. Okay, so let's go through some of these symptoms of thyroid condition. Okay, the symptom is fatigue. No matter brain fog. So no matter what you do, even if you're working, even if you're studying, even if you're sitting there, you do nothing, your brain seems to be fogged up. You're not clear. You seem to have lost directions, loss of a sense of what to do. Okay, your weight is growing. You've been putting on weight continuously. You haven't eaten much. Matter of fact, you eat less and less and less. But your weight gets more and more and more. You're getting bigger and fatter and more weight. Okay, you can't sleep. Insomnia. You toss and turn. You sleep for an hour, 2 hours, maybe 3 hours at most, and you get up and you can't sleep anymore. Or you wake up 5, 6, 7 times in the night, just cannot get to sleep. You have horrible depression. Everything you do make you depressed. Even the things that used to bring you pleasure make you depressed. Okay, you have constipation. Sometimes you go once a week. Sometimes you go once every 2 weeks. Okay, your stomach is always feeling full, feeling stuffed. Okay, your hands cold, your feet are cold. Even though it's hot outside, inside of your body it's like a freezing. You have a freezing cold sensation inside of your body. Okay, very bad circulation. Okay, circulation, because your hands are cold, your feet are cold, your circulation is bad. Okay, your color is turning, the face, the hands, the feet, the colors are turning more grayish. You have joint pain. Every single joint in the body seems like there's a knife stabbing at the joint. Seems like the muscle of your body is painful no matter what you do. Even when you're sleeping, even when you're not moving, there's pain. All over, the pain is all over the body. And you have flu and you cannot, it takes a long time to recover. And you're feeling tired, you're fatigued, you're feeling sleepy all day long, you feel so tired. Even you had a long night of sleep, you still wake up very, very tired. Okay, your heart's beating like crazy and you'll have irregular heartbeats. And sometimes heart beats fast, sometimes heart beats slow. You can't control your heartbeat. Okay, stomach ache, bloating, gassy, and your skin is dry, it's itchy, and it's all red, and sometimes there's eczema, there's patches of white mark on the skin, white or red mark on the skin. And your hair seems to be losing more and more hair, your hair is brittle, your hair is getting thin, and you think you might be going bald. You might be going bald. You're afraid that you might be going bald. Your face is bloating, okay? Your throat is bloating. It's getting bigger. Your legs getting bigger. Your hands getting swollen up. Everything is getting bigger. And you have horrible hot flashes. You sweat at night. You toss and turn at night. You keep on sweating. Can't sleep. Okay. And are you angry? You're frustrated. Because you have been to so many specialists. You've been to so many doctors, endocrinologists. They cannot find a solution for you. Whatever they did, there seems to be normal. There's nothing they could do, and you're so angry, you're so frustrated, and you lost confidence with every doctor, with any medical procedure. You have no confidence at all, and you think that no one can help you. Every single thyroid patient has the same kind of mindset, that they've been through everything, that nobody can help. Okay, and they're probably asking me the same question. Why do you think you can help me? How do you think you can help me? Okay. But I want you to know there is hope. There is a lot of hope. Okay. So let's go and continue talk about functions of thyroids. Okay. So what does thyroid do? Thyroid help you build up the bones, help you increase your activity levels. Thyroid help your immune system. It builds up your immune system so you won't get flu so easily. It helps you support the brain, function of the brain, memorization. Helps your nervous system. Okay, so help you a better sensation. Okay, help you better function the muscle as well too. Supports the endocrine system, your hormone system. Okay, your ovaries, your testicles, your spleen, your pineal gland, your thyroid gland, everything is all controlled, is all connected with thyroid. Your thyroid also supports your gastrointestinal function, stuff you eat, and the stuff that's digestion and the pooping, its entire process is all connected with thyroid. Okay, thyroid supports liver and gallbladder, and if your thyroid function is bad, your liver and gallbladder, for sure, the function is going to go down. Your sex hormone, your growth hormone support you by thyroid. And thyroid helps you burn fat. A lot of patients, when they're overweight, clearly most of them have issue with thyroids. Okay, so weight gains. Okay, if you have insulin problem, if you have your glucose problem, it's also associated with thyroid condition. Okay, if your cholesterol level is high, it's also thyroid related. So So if you have burning stomach acid, you're regurgitating acid from your stomach up to your throat, that might also be connected to thyroid. Okay, so every cell in your body has a thyroid receptors. So what's blocking? What causes all these? What causes the thyroid to go haywire? What blocks our body so that what prevents our body to heal thyroid in itself? What prevents it? Okay. Number one issue that causes the thyroid condition is autoimmune. Autoimmune. And autoimmune means that your body's immune system is attacking your own thyroid. Okay. Your body's immune system is attacking your own thyroid. And how do I know? Okay. How do I know you have hypothyroid, which is Hashimoto? How do I know you have hyperthyroid, Graves' disease? Both of these are autoimmune issues. Okay. How do I know if I or you have autoimmune issue with your thyroid? The best thing to do is blood testing. That's the best way to test. Okay. So what kind of blood tests do we need? Let's say if you went to your medical doctor. Most of the medical doctor, they only test for TSH, which is a thyroid stimulating hormone. If you're lucky, they also look at your total T4. That's all they see. And most of the time, if you have severe thyroid condition, most of the time TSH and T4 they're normal. They're normal. Okay, that's why you cannot find out. And there's other thyroid tests. So compared to these thyroid tests, FTI, free thyroxine index, free T4, T3 uptake, free T3, reverse T3, TPO, TBG antibodies, TSH antibody, T4, and T3 total. This is what I do for patient. So when patient come to me, this is what I tell them to do. Okay. Now the very important thing, the most important thing about finding the autoimmune is TPO down the bottom, right here. TPO and TPG. This is the primary test for the antibody in your thyroid to see if your body is attacking your own thyroid. This is the best, the most sensitive test available for now. Okay. So everybody who has thyroid issue have to do this kind of test. Okay. So on top of that, I also have patients do the white blood cell, the red blood cell, and basophil, eosinophil, neutrophil, leukocytes. All these are part of white blood cell. Okay, most of the medical doctors do not do these kind of testing. T and B lymphocytes, natural killer cells, cytokinins, which is interleukin 2, 4, 10, 6, T helper cell 1 and 2, IgG, IgE, IgA. These are extremely important immune panel that you have to get tested. These are the tests that your medical doctor, your endocrinologist, your specialist do not know how to test. Okay? And let's talk about lab ranges. There is a normal lab range and there's a functional lab range. Okay? So a normal lab range is the entire range of the lab ranges. This is the functional lab. Let me show you an example. So, in a traditional, if you look at glucose, in the traditional lab ranges, the normal range is 65 to 110. But the functional range is 85 to 100. So if your glucose comes up to be 73, compared to a traditional range, you are at a normal range, 73. But compared to functional range, you are not normal. You have low blood sugar. Okay? So why do we look at functional range instead of traditional range? It's because the functional range is for general population. And throughout the years, medical community have expanded the functional ranges because people are getting more sick. And medical doctor wanted to kind of tell people that, we shouldn't tell them, we shouldn't show them that everybody's sick. We should kind of expand the range. So only show the severe person that is sick. Those who are not severe ranges should be normal, so we should tell them they're normal. Okay, this is wrong. We should always look at functional range, because if your lab test is outside the functional range, it means that the symptom you have is related to that particular functional range. Okay, so glucose, of course, is not normal if with functional range. TSH, thyroid stimulating hormone, is not normal in the functional range. Okay, that's one of the reasons why all your blood tests shows normal. Because your doctor analyzed the blood result under traditional ranges. This is a range for everybody. For people who's old, for people who's young, for people who's sick, for people who's healthy, everybody. Okay, but you shouldn't be like everybody. You should be specific. You should be special. Inflammation. Inflammation is one of the major cause of thyroid condition as well too. Inflammation could be cause so many issues. It could cause muscle pain. Inflammation could cause joint pain. Inflammation could cause stomach acid. Inflammation could cause pain in the head, headaches, nausea. Okay, so how do I know? Because whenever you have a thyroid issue, you have all the other symptoms which we just discussed above. So how do I know you have inflammation when I tell you? Okay, the only way to know, again, is blood tests. Okay, so if you look at the amount of tests that we do for patient, you should do homocysteine, C-reactive protein, RA, ANA, ESR, uric acid. These are specialized inflammation indicator. And we also test for fasting glucose, HbA1c, HbA1c. Why? This is to test your blood sugar. Because if your sugar level is high, the high amount of sugar level will eventually turn into inflammation, will cause body to have more inflammation because of the high level of sugars in the body. That's why whenever we treat patients, we always tell them, you gotta take the sugar out, gotta get rid of the sugar in order to have a great result with your thyroid conditions. Okay. Another way to test your inflammation sugar is to get you can buy a little machine, zap your own finger and put a drop of blood into your machine, and it will give you a reading of the sugar level. Okay. And another big thing about thyroid is pH. If your body is over-acidic, it could cause a lot of issue. When your pH is out of range, normal range, all sort of bad things happen. For one thing, disease-producing organisms thrive. This explains why some people exposed to certain bacteria or viruses or get sick while the other does not. As the condition can cause muscle to constrict and inhibit the exchange of nutrient and waste product in muscle cells, causing fatigue, soreness, pain, and all sort of bad things. Okay. So pH is extremely important factor in dealing with thyroid recovery. Okay. So how do we test? You get a pH strip. Put a pH under your tongue or pH for urine to see the level of your pH in the body. Or you can do a blood test for pH testing as well too. Okay. Another reason why your thyroid would go bad is because of stress. Stress and other bad organs. Our body is like a web of system. When one organ goes bad, all the other organ goes bad at the same time. Right? If your liver goes bad, your skin turns yellow. If your kidney goes bad, you have back pain. If your heart has problem, you have pain in the shoulder. All these we call referred pain. The body is all connected together. So if you have other issue with other organs, it will also cause problem to your thyroid as well. Okay. That's why we gotta take care of your other organs. And other organs carries emotions with them. Let's say if you are highly stressed, you have a lot of fear. Okay, kidney carries fear, sadness, and depression. If you have a lot of fear, a lot of sadness, a lot of depression, it will start affect your kidney, and the function of the kidney will affect thyroid. If you have a lot of sadness, okay, anxiety, depression, it will cause dysfunction to your lung. You have issue with anger, impatience, okay, it's issue with your heart, okay. If you have anger, jealousy, envy, it's issue with your liver, okay. All these interpretation came from the 5,000-year Chinese medicine traditions, okay. And these could be tested by putting pulses, by touching pulses on your wrist. You can find out what kind of emotion is affecting what organ in the body. Okay, so traditional Chinese medicine, it's been 5,000 years, and there's tons and tons of research about acupuncture, about Chinese medicine, about the effectiveness of this treatment to the bodies. Okay, and by doing pulses, not only can we find out the function of the organs, we can find out the emotion, the stresses affecting our body. We can also find out the heat, the cold, the damp, the fluid, the blood clotting, and other issue as well too. Okay. Hormone imbalance could also cause issue with thyroid condition. Okay. So how do we know hormone? We do hormone blood tests. All right. So the hormone blood test includes estradiol, estrogen, FSH, LH, prolactin, testosterone, and testosterone-free. Okay. These are blood tests for hormone issue. And the next issue that affects the thyroid is it's a brain. It's neurological conditions. If you have an imbalance of your neurological symptom in the brain, it would highly affect the function of thyroid, therefore affecting the thyroid to recover. Okay. And the neurotransmitter in our brain, neurotransmitter is like a message in between the nerve cells. If one nerve cell cannot transmit information from one to another, then they cannot transmit the information to a thyroid, therefore thyroid cannot function correctly. Okay? So we do the brain testing by having patient wear a cap. And we scan the brain using computer. And after computer it is done, the computer will give us a coloration of what's normal and what's not normal. Okay? And what do we test? We test all these points. Okay, F3F4, C3C4, PCP4, O1O2, all these brain points will be tested by we call it brain scan. Okay, and this brain scan is highly accurate. And another way to test for neurological testing is physical examination. So the way to test is we get a fork, a tuning fork, and we compare the sensation of the shoulder to the sensation of the thumb. Sensation of this shoulder to the sensation of this thumb. We compare the sensation of both thumbs together. We also test sensation of the back in relation to the big toe, both toes. Okay, that's how we know if your neurological sensation is blocked or not. Okay, that's another way to test for thyroid condition.